Welcome to the MediByte channel. I'm your host, and as a healthcare professional, I'm here to guide you through a critical, incredibly painful, yet totally misunderstood female reproductive health emergency. We're talking about adnexal torsion. Today, we're going to break down this complex medical event into a complete, detailed, and really easy-to-understand explainer. We'll explore exactly what happens inside the body when this strikes, and why you absolutely have to take immediate action.
Okay, so here's our roadmap for today. We'll start with what adnexal torsion actually is, then move into the causes and risk factors. After that, we'll cover how to spot the symptoms, how doctors diagnose the problem, and finally, the emergency treatment options. Let's just dive right in. Section 1. What is adnexal torsion? The mechanics of a medical emergency.
To really wrap your head around this, I want you to picture a garden hose getting completely kinked. The ovaries and the fallopian tubes, they're supported in the pelvis by these ligament-like tissues. Now, in adnexal torsion, the ovary, and sometimes the fallopian tube gets dragged along with it, literally twists on those supporting tissues. And when this twisting happens, it acts exactly like that kinked garden hose. It completely cuts off the organ's own vital blood supply. And without that blood flow, the tissue essentially begins to suffocate. And you know, what's really striking about this condition is just the sheer absolute urgency of it. In the medical field, we have the saying, time is tissue. Adnexal torsion is actually one of the most common medical emergencies for women, especially for those of reproductive age. Every single minute that the blood supply is cut off, the risk of permanent, totally irreversible damage to the ovaries skyrockets. It's truly a race against the clock. Moving on to Section 2, causes and risk factors. Why does it twist in the first place? Well, the data shows that the main trigger usually boils down to a structural problem with the ovary itself. Think of it like this. An ovary that is enlarged or weighed down acts kind of like a pendulum, making it super prone to twisting. This enlargement often happens because of cysts during pregnancy, specifically what's called a corpus luteum cyst. It can also be triggered if you're using hormones for infertility treatments to stimulate ovulation, or honestly, just from the everyday presence of cysts and tumors. And here's a crucial point. If you've actually had an episode of adnexal torsion in the past, your structural risk for it happening all over again goes way up. Now, you might naturally assume that a malignant cancer would be the primary cause of such a severe complication, right? But the research actually points to the exact opposite. Non-cancerous, benign growths, like common cysts or benign tumors, are practically the main culprits here. They're the ones adding that heavy physical weight and mass that destabilizes the ovary and sets the stage for a torsion event.
Section 3, spotting the symptoms. These are the red flags you absolutely cannot ignore.
You're probably wondering, how in the world do I distinguish this from, say, normal menstrual cramps, ovulation pain, or even just a nasty stomach bug? It's such a vital question because brushing this kind of pain off as something minor can have devastating consequences.
The absolute, undeniable hallmark sign of torsion is a very sudden, incredibly intense pelvic pain. It literally hits you out of nowhere. And this pain is usually isolated to just one side of your body, because torsion typically only happens on a single side at a time. Plus, this severe pain is almost always accompanied by really intense nausea and vomiting. You might also feel extreme tenderness if someone even touches your abdomen. And in some severe cases, your body reacts to the whole crisis by spiking a fever or sending your heart into a rapid racing beat. But wait, pay super close attention to this detail, because sometimes your body gives you warning signs long before the main event. You might actually experience this intermittent, crampy pain for days or sometimes even weeks beforehand. Why? Because that heavy ovary is temporarily twisting, cutting off the blood flow for a bit and then naturally untwisting on its own. If you ever notice this repeating pattern of sharp, unexplained cramps, please do not ignore it. Which brings us to Section 4, diagnosing the problem. Here is the medical response. So let's say you recognize these severe symptoms and you rush to the emergency room. The medical team is going to rapidly move through 4 key steps. Step 1, they evaluate your symptoms right away. Step 2, they perform a physical pelvic exam just to check for that tenderness or any masses. Step 3 is crucial. They heavily rely on imaging, specifically a transvaginal ultrasound, using a special technique called colored Doppler. This gives the doctor a real-time look at the blood flow. If that Doppler shows that blood flow to the ovary has stopped or is severely restricted, well, they jump right to Step 4, rushing you straight into exploratory surgery. Because honestly, getting in there and looking is the only definitive way to confirm the twisted organ. Section 5, emergency treatment options, saving the ovary. So, immediate surgery is required to physically go in and untwist the organs.
Surgeons basically have two approaches here. Whenever possible, they much prefer a minimally invasive laparoscopy. This involves just a few tiny incisions in the abdomen, a specialized viewing tube, and the best part is it usually doesn't even require an overnight hospital stay. However, if the ovarian mass or cyst is just too large, they might have to do a laparotomy. Compared to the laparoscopy, this one requires a larger traditional incision so the surgeon can directly view everything. And yeah, that does mean an overnight hospital stay and a bit of a longer recovery.
Once the surgeon actually untwists the ovary, what happens next depends entirely on how fast you got to the ER. If the ovary is still viable and it's just a pesky cyst causing all the trouble, they'll do a cystectomy, which just means carefully removing the cyst while saving the ovary itself. But if there's a larger tumor in there, they might have to perform an oophorectomy, removing the entire ovary. And tragically, if the blood supply was cut off for just too long and the tissue has already died, they have to perform a salpingo-oophorectomy. That means entirely removing the dead ovary along with the fallopian tube.
Let this sink in for a second. If the blood supply to the ovaries is cut off for too long, tissues in these organs may die. That striking quote directly from our medical sources is the ultimate takeaway for today's explainer. It perfectly highlights exactly why you have to act fast. Because, like we said at the start, time is tissue. A twisted ovary simply cannot survive without blood. Never, ever brush off sudden, severe pelvic pain. Recognizing those signs early, that is literally the only difference between a quick procedure to untwist the organ and permanently losing your ovary altogether.
So I leave you with that provocative thought today to ensure your reproductive health and emergency awareness stay front and center. As a healthcare professional, I really want to thank you for dedicating your time to exploring the science and understanding your body with us. Thank you so much for watching, and please take a second to like, share, and subscribe to the MediByte channel for more essential, life-saving medical explainers.